Hello, I am Dan Doherty, the Executive Director of Alcuin Studies Center in Muncie, Indiana, and we are talking today on questions of faith in medical practice. I'm going to have you guys go around. Bart Peterson. I'd like you to start off here. Bart kind of initiated some of this with me, or I initiated with him. I don't know exactly which direction that went, but if we can go around and just say your name and your location and what your role is in that location and interpret that however you want. Bart, I think you're muted. That's that's all right.
All right. Thanks, Dan. I'm Bart Peterson. I received my PhD in biochemistry and molecular biology from the University of North Dakota School of Medicine and Health Sciences. I then did a postdoc in Indianapolis at the School of Medicine, and I'm now at Indiana University School of Medicine in Muncie, where I have the privilege of teaching medical students. And the reason that I'm kind of involved today is because several years ago, I realized that I was compartmentalizing my faith. And since then, I've been passionate about working towards the goal of more effectively integrating my faith in my work. And so I'm very excited to be part of this discussion today.
Fantastic. Thanks, Bart. Matt, you're the next one on my screen.
My name is Matt Schulke. I'm currently an 8th year MD PhD student at the Mayo Clinic in Rochester, Minnesota. I did my PhD, finished that about 2 years ago, in immunology, studying cancer immunotherapy for pediatric brainstem tumors. And I'm interested in going into pediatric cancer in the future. I recently matched at Children's Hospital of Philadelphia into their physician scientist program, where I'll probably be staying for residency in pediatrics and then fellowship in pediatric hematology and oncology. Yeah, and I guess that's me. I'm hoping to integrate faith and medicine. Have also a passing interest in pediatric palliative care as well, which really integrates pretty well.
Fantastic. Thanks, Matt. Andy Vaughn.
Yeah, my name is Andy Vaughn. I'm a general internist at the Mayo Clinic in Rochester, Minnesota. I've been there for a little over 30 years. Most of my patients are retired, and so I do taking care of chronically ill patients mostly, and been a Christian for all my life, and look forward to this discussion.
Great, thanks. Kayla.
Hi, I'm Kayla Nixon. I am currently in Chicago, Illinois. I'm at Northwestern here doing a fellowship in minimally invasive gynecologic surgery, and that is after completing my obstetrics and gynecology residency and medical school at Mayo Clinic in Rochester. So I have had lots of opportunities to integrate faith and work. I think particularly when I was confronted with a lot of the ethical issues that are inherent in obstetrics and gynecologic care, as I was working through those, a lot of other mentors and church friends and family have been really helpful in helping me navigate that. So that's one piece that I hope that I can share.
Yeah, that's great. And last but not least, Keith.
Keith Miller. I'm a retired orthopedic surgeon in Muncie, Indiana. I took actually an early retirement at 59 just because there were other ministries that I wanted to be a part in. And I think that I have a little bit of an opposite view or history, that I really did not interchange faith in my practice until the last few years of my practice. I went to a church. I grew up in a church that we went regularly to church, but faith wasn't. Faith wasn't. I wasn't opposed. I embraced faith, but I didn't make it an active day-to-day part of my life. And it wasn't until really after residency that I really was changed by my first missions trip down to Mexico, that really transformed just my outlook on the way I should be living. and I've been very, very blessed since then with just using my faith more and more and more.
Fantastic. Thanks, Keith. Well, we're going to dive into some questions here. So Bart has compiled some questions that he's heard over the years from students regarding the intersection of faith and medicine. And so we want to kind of just be of help to these medical students who have these questions. I passed these questions out to all of you ahead of time. I don't know if Keith, you were the last one, I think, to get them. So I don't know if you've had time to really look them over or not.
Yes, I did.
Okay, fantastic. What I'd like to do is see if, for those of you who now have been either in school for a decade of your life, Matt, or in the practice, which of these questions did you feel were most relevant or urgent? And would you speak to those? So whoever would like to go first there, which of these questions stuck out to you as, oh man, this is a great one that I've really encountered and I would like to speak to?
Hey, Dan, I'll start.
Yeah.
And the question that stood out to me that probably means it's probably the thing that I think about the most was the question, how does your faith inform your work as a physician? And perhaps the reason this stood out to me so much is because of how much I've been thinking about the doctrine of vocation for the last 4 years since the 500th anniversary of Martin Luther nailing his theses to the church door at Wittenberg. And I read some of his stuff on vocation, and it had such an impact on me, not just in medicine, but in every other one of my vocations. My vocation as a husband, my vocation as a friend, my vocation as a citizen. And how does my faith inform my work as a physician? First of all, to be a Christian physician, I'm not a surgeon, but if I was a Christian surgeon, I wouldn't be sewing people up with crosses on on the incision. That's not how I would indicate that I'm a Christian. And as an internist, the first thing I do is try to be an excellent internist. I serve God best by, as Dorothy Sayers said, serving the art of medicine. I try to be the best physician that I can be. Now, do I succeed? Well, no, almost no day do I, maybe not even every minute of every patient encounter, I don't succeed. But I try to approach that line up there, and some days better than others. So I serve God best when I be the best physician I can be.
That's
I'll
fantastic.
come from the medical student side too. I think the medical student side, there's a lot of pressures in medical school. And recently there's been some pretty high profile suicides of medical students in the state of Minnesota at both the medical schools. And so one thing I've been thinking about a lot is burnout and what does it look like to be sustainable in your practice. And so as a Christian, I've thought about what does it look like for me? How do I maintain a pace and a practice that I want to have for a career where I'm pouring myself out to patients and finding value in my work? Because a lot of the burnout literature is showing that when you find value in your work and meaning in your work, that's actually when you're gonna not burn out, not when you're getting paid more, not when your hours are better, not those things can contribute, but actually having purpose is really important. And so thinking about my calling to medicine, I feel that I'm here to be poured out for my patients, their families, and even especially in palliative care and cancer in these really dire circumstances. But that at the same time, I need to be recognizing that the Lord has called us to rest, and that rest is an important part of things. I need to recognize that the Lord has given intrinsic value to all these people, and that the people are why I'm interested in medicine. And so, kind of coming at it from a personal, how do I continue as a human being to pour myself out? And you don't only pour yourself out if you're being poured into both by the Lord directly and as in the people that he gives us in the church. And so I've kind of very intentionally engaged in those communities in my training here at Mayo, whereas perhaps some of my colleagues and the typical pre-med or medical student response is, I just need to engage more into medicine and more into my studying to become a better physician. I think that grounding ourselves in what the Lord has provided for us, I think is a really important and essential part of it.
That's great, Matt. Thanks. I have actually a quick follow up to that, and that is the kind of it seems now I have nothing to do with the medical field, right? So if this is an ignorant question, just tell me. But it seems as though that there a common logic would be exactly what you said. The more I can do science and medicine, the better physician I'll be. I know you personally. I know that you have poured a lot of time into music. And I also, know a friend of ours who purposely did his undergrad in philosophy rather than in science or medicine. Is there something about kind of the humanities or the arts that makes for not just a balanced life, but a better physician?
Yeah. I will give an answer, and then I will intentionally punt to Dr. Nixon, who has a degree in art history that she got in the middle of medical school. So I'll give the amateur answer, and then she'll give the professional answer. So yeah, no, I think that's absolutely true. I think that medicine, as medicine, and I would be curious to hear from the older physicians as well, as medicine has become more and more bureaucratic, technocratic, kind of commoditized in many ways. I think that a lot of patients are no longer having the same satisfaction in their physician relationship. They're saying, well, but I don't see the same person every time. I don't have that relationship. We look at the distrust of the medical system. And I think what a lot of that is pointing to, and I've read others who are pointing to it, is that it's losing the humanity, the personal relationships that are part of medicine. And as I was thinking about this panel in the last few days, one of the quotes that came to my mind that really informs how I've tried to see patients is C.S. Lewis, who said that you're never having a conversation with a mere mortal. The people that's from The Weight of Glory, if you're looking for a great half an hour, 45-minute read. The patients that we're seeing are not bags of solutes. They're not entropy eventually moving towards death. These are people who are created, who are eternal and are made in the image of God, and that I think puts a layer on top of my care for a patient that simple scientific knowledge isn't going to be able to accomplish. And I know that, Dan, one thing that you've impacted in my life is giving an idea of the moral imagination, that not only should I be being formed more and more in my vision of what science and medicine is, I'm going to be formed more in my vision of who people are. And so one thing, I'm moving out to Philadelphia for residency. It's a big city. I've never lived in a big city like that before. One thing I'm going to be very intentional about is engaging in literature that's from those families that I'm going to be caring for, because I don't know what it's like to be a person who's impoverished in West Philly. I have no idea. I grew up in suburbia, but the humanities are able to, and obviously seeing those patients will open that to me as well. But even I can't see them right now. I'm here in Rochester. And so how can I be learning with these people? I can be engaging in the literature that they've wrote, engaging in the history of that region, and seeing more about what makes them who they are. But I could ramble this for a while. I want to hear what Dr. Nixon thinks.
Thank you. And yes, Dan, absolutely. When you mentioned your initial question, like, is there a role for the humanities? That is a charge that I hope to take up throughout the rest of my career, that I very passionately believe there absolutely is, and that the humanities is really vital in making better physicians. And when you think about even just the origins of medicine, it really kind of grew out of the church in a lot of ways. And then it grew out of even modern medicine was out of Renaissance artists who were studying anatomy and contributing things like that. So there, that was the time when a lot of the humanities fields were really blossoming, and then leading into the Enlightenment and things like that. So the fields have really always been linked throughout the majority of history. It's really just been really in like I would say like the last 100 years that we've seen this maybe like disconnectedness where I think a lot of it originated when they tried to like kind of standardize medical care. And, the goal was to improve a lot of quality, but it really did become more commoditized and more of a focus on, the illness as opposed to, and like a fix, a correction to the illness as opposed to looking at the whole person. But I do think that, even just throughout my training, I've seen a shift where maybe a lot more push when we were initially discussing a lot of the healthcare delivery systems changes and things like that. There was this push towards value and quality. And I do think that a lot of that has impacted medical training and education as well. And now it's really becoming pretty ubiquitous to have some sort of humanities education in a lot of the major medical schools. My personal interest is in like the visual arts, and there's a lot of different ways that schools go about doing that, but they sometimes will have like visual arts engagement sessions with medical students where you go to a museum and you're looking at paintings and trying to pick out some of the specific very subtle traits and see how that transitions into like, or how that contributes to your understanding of what the artist is really trying to say. And a lot of that translates into meeting with a patient in person, just picking up on subtleties of their behavior and being able to use that, nonverbal information to inform the medical condition that they're having. And a lot of the work in burnout and things like that are utilizing a lot of the humanities education too, and narrative medicine. It's that's a big field where storytelling is basically used as the structure of framing how you interact with the patient. And it is, you're trying to unfold a story from a person that's sitting in front of you. And a lot of the humanities literature and the arts and there's evidence that even shows that like students that have some of the background in some other fields like that have lower rates of burnout, which is one thing that is a new like current and ongoing discussion. But probably pick up on some of those more like artistic pieces of medicine. And I do think that of course like our faith influences that pretty dramatically. I think in part of the importance of integrating our faith with our work is this. It's really, to me, just focused on being like a whole, well-rounded human being, and not like I have a passion for the arts. I want to incorporate that into how I serve my patients. I have a love for God. I want to incorporate that into how I serve my patients. It's really, I see kind of as we were talking about the question about, how does our faith inform our work? It's really like the calling, the vocation, all of it is a way to serve the Lord. And He's given us multiple different gifts that we should all be using, or be using all of them as we can, whether it's in work or in life, and hopefully both, to glorify God.
It's beautiful. Thank you, Kayla. Anybody else on that topic that you want to add anything to? Fantastic. Let's maybe some practical ones. I know as Bart and I have talked, the question of praying with patients, and it seems like this is kind of linked with several things. If your patient is of a different faith, do you pray with them, and if so, how? What are your interactions with chaplains? And then one interesting one that I've heard is even those who are unbelievers, physicians who are unbelievers, or students who are atheists, saying if a patient asks me to pray with them, what do I do? Do I fake it? Do I, is that a comforting thing, or what's the right thing to do there? So kind of maybe getting into a couple of those practical, not that the rest has actually been extremely practical in many ways, but into the kind of some real nitty gritty pieces there. What What would you say to any of those?
Well, Dan, I'll give my answer to that question. My background is that I went to a Christian grammar school. I went to a Christian high school. I went to a Christian college. I went to a Christian medical school. And at my medical school, we were encouraged, and I would say even taught how to pray for our patients and with our patients. And so I pray with patients with some regularity. Now, I I would say 99% of the time, the people I pray with are Christians, or at least profess Christianity. And they don't have to be Protestant, might be Catholic, but uh, I pray when, as usually we're dealing with some particular medical issue that they're struggling with. Um, they initiate some kind of faith um, statement, and they may not ask me to pray with them. Uh, but if they open that door, uh, most of the time I will walk in. And before we finish the appointment, I will ask him, "Is it okay if I pray with you?" I have never ever had anyone say, "Oh, no, 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 I don't want you to do that." Um, and That's also because of my background. When I ask the patient if I may pray with them, and they say yes, I will touch them. And I don't usually ask permission. I just reach out and touch them. I probably should ask permission, but anyway, I uh, I will pray with them. And sometimes maybe they don't open the door that day in such a direct way, but I know from talking to them before, because most of my patients I've seen for even decades, that this person is a Christian, or at least has talked about going to church, and so there may be a connection, and maybe they're not even a Christian, but they've attended church, and they've talked to me about this. I will still pray with them. And if a patient ever asks me, uh, uh, as we're wrapping things up and maybe things are looking a little bleak or challenging, if they ever ask me, uh, you know, uh, say a prayer for me, I'll say, well, I'll say a prayer for you right now. And we pray right then. And uh, so um, I, there's that. And then in terms of the question, uh, praying with someone of another faith, I don't remember ever being asked by someone who's a Muslim or an atheist to say a prayer for them. I might have. I don't think I ever did. But if they asked me to, I would pray as a Christian for them. Um, and then my last thought regarding if I was an atheist. Now, hard to imagine what an atheist thinks like, not being one. But I don't think it would be honest to pray for someone if you're not a believer. That's phony, not helpful. That's my thought on that.
Thanks. Anybody else on that one?
Share a quick anecdote. So honestly, that's part of the reason I'm really interested in palliative care. So the palliative care model is kind of similar to the hospice model. So it's an idea that to support patients at the end of their lives, there needs to be a holistic, integrative team of MDs and nurses and chaplains and therapists, and this really group practice that is able to treat the person as a whole person. And so here at Mayo, in my rotation on pediatric palliative care, we had a chaplain who was embedded with the team, and it was incredibly valuable for the physician to, the family we were caring for, the parents of this very, very sick, who eventually died child. They were Pentecostal minister and his wife, and they were from a different culture, and so the team was coming up against medical challenges and questions of comprehension. Was it comprehension? Was it a faith thing? Like, where was the block? But there was clearly a block. And so the chaplain was someone who was able to not only interpret what the family was going through and give wisdom to the team, but ultimately when they actually kind of fell on the outs of the medical team, he was the avenue by which we could communicate to the family and show our support to them, and in our role as a palliative care team. So I think that chaplains are really, really wonderful members of the team. Do I think that they're all coming from the same theological background as me? Absolutely not. Do I think that's a reason I shouldn't work with them? Absolutely not. I think that they certainly have things to offer to the team, and are really helpful. As far as praying with patients, my medical career is much shorter than anyone else's here. It hasn't even really started. But I think every advice I've heard is, that same thing that Dr. Ron was saying of, if patients open that door and they say, this is my faith background. I've had definitely half dozen conversations with families about their faith when they've done that. There have also been one or two other instances I can think of where it wasn't brought up, but it was just so obvious to me that this patient needed support and needed someone to pray for him. And so I recall a specific patient. She was being emergently, had an emergent EGD for some gastric bleeding, and she'd been whisked up to the ICU, and she was panicking. And one of the wonderful things about being a medical student is that no one expects anything of you, and you're not really doing anything. You're not really very helpful, but you can be there. And so while that patient was being sedated and was, really having a very terrible time, I held her hand. I said, "Can I pray for you?" She said, "Yes, please." And so I prayed for her and held her hand when she went to sleep. And it was probably one of the more meaningful experiences of my medical training, of it just being obvious that this person needed this and this person wanted this. And I mean, as Christians, we're given the Spirit, and I think that was probably the Spirit leading me to do that. So I think just also trusting in that leading, and as Dr. Nixon was saying, like knowing people enough and knowing human beings enough that you're picking up on these cues, that once again, they're not just a bag of solutes that, the world threw together and you're going to help balance their, sodium. Like, no, but that this is a person who has needs and has fears and is coming from somewhere. And hopefully, a patient well enough to know where they're coming from and what they're scared of and what their history has been and what their family is. And these things that are going to inform you about, well, this might be why they're reacting this way. And this might be something that they actually would want prayer for. And so being attuned to that, I think, is really helpful.
Great. Thanks, Matt. Keith, it looked like you had leaned forward a little bit ago. Do you have some thoughts on these same questions here? Oh, you have to unmute. Sorry.
Yeah, as I said, I prayed later on in my career, and I never had a patient ask to not be prayed with when I asked them. And I think I saw nothing but appreciation for the fact that their physician would pray with them. And they would come back in, several would come back in afterwards for follow-ups, and again, just thanking me for taking the time to pray with them and to care for them that way. And especially preoperatively in the holding area. There's certainly a lot of anxiety before surgery for a lot of people, and they were always very open to prayer. And I think that just it helped the relationship between me and the patient, but also gave them a great deal of peace. I think that was a powerful addition to my ministry as a physician.
Fantastic. Thanks, Keith.
One more thing.
Sure.
So I think as I've gone, once again, maybe doctor here, I think that a lot of our ministry is not just to our patients, but it's to our colleagues. And so thinking about, what that palliative care rotation and this case that was incredibly sad and tragic, and there can be a medical provider physician kind of back channel conversations that happen. Like, I can't believe that this family is still holding on to hope, or, they're clearly really praying for it. And I think that as a member of the team, I can respond in different ways. There's a way of saying, they really are holding out for hope. And kind of what I chose to do during that was I said, yeah, I'm praying for them too. And I was praying for them. And I think that praying for our patients on our own time and being open to our team in whatever setting that means, that we're also praying for them. We're hoping for them. And I think other people will say, I really hope that this patient does this, or who knows what's going to happen. And to say, yeah, I'm aligning with that family, that I also am hoping, and I'm even praying for that. I think communicate something to our colleagues, and I think we can share our faith with our patients, and I think that is appropriate in some scenarios, in many scenarios. But also a lot of times, if you're an ER doc, your patient is coming in, going out, and they're never going to see you again. Hopefully, because they're not going to go back to the ER because they're better. That's wonderful. The relationships with our colleagues in medicine are going to go for decades. And so I think our witness is also not just to our patients, but to our teams. If we can communicate our whole person as we share that we're praying for patients.
That's a wonderful reminder, and kind of something that I was thinking about as you were talking. I was mostly thinking about how encouraging it is to hear that you all pray with patients as regularly as you do. I tend to, as a surgeon, pray for patients. Often I'm holding their hands as they're going to sleep in the operating room, but not always out loud, usually just like personally. And I think that kind of echoes to another question that you had sent out, Dan, about like what are some of the challenges in the medical field that are unique for Christians. And for me, I have, throughout all of my training, really felt that some sort of isolation as a Christian has made it hard to be as like authentic in the workplace about my faith and how important that is to me and how much it informs my decisions. And I think it probably is because of a lot of perceived hostility to faith in healthcare and scientific fields in general. But specifically in obstetrics and gynecology, there are a lot of issues where, you know, things that I don't feel are compatible with faith are seen as very routine, and it's assumed that everyone agrees. And so I definitely think that for me, it's been a huge challenge just to be an authentic Christian and to really practice with what feels fully, like I have on integrity in a lot of ways, just to really be vocal. And it's, I think I choose my battles. I am honest when the situation calls for it, but at the same time, I don't pray with patients out loud as much as I do like internally in my heart. And maybe that is part of that, partly because of that challenge that I feel.
Just to follow up on what Dan, if I may,
Yeah.
one more comment about this. Follow up on what Kayla says. I also routinely pray for patients, even if I don't pray with them. As she said, I come to my computer at the beginning of the day and I see this list of patients, and I'll very often just go down the list and pray for them, and for me, as I'm about to see them, that God would grant me, wisdom to discern. And then one last thing regarding prayer is that there have been a handful of times. My patients, I've known, as I said, many of them for decades, and some of them I've gone to church with, and I go to church with, and or they might know for whatever other reason that I'm a Christian, and what do you know? They ask to pray for me sometimes. And they'll ask the patients know me, and how's your family? And well, some patients, even if things aren't so good, I might say it's fine, but to others, yeah, a little bit better relationship maybe, and I'll say, well, going through a little bit of a struggle with so and so. Well, can I pray for you? Great. And so, what a privilege it is when a patient will pray for me right there. And I've had other patients and I tell me that I pray for you, thank you. And so privilege of part of the relationship of being someone's physician for a while.
Sorry, I'll add one more thing. This is becoming a prayer panel, but I think it's important. Patients are sometimes have certain challenges to the providers. There are patients who either don't trust the providers. There are patients who are dealing with their own issues. I think that we call these challenging patients. There's I'm sure there's many more medical slang for that I don't know yet. But I think that part of what I was describing before about caring for patients as whole people is continuing to care for them even when they are making our jobs more difficult, or when they aren't listening to us, or whatever it is. And so I think that prayer is one thing that is a really powerful tool that the Lord uses in our hearts to continue making them soft towards people who might be hard to love. And so I think that that's another way that praying for patients can really, keep our hearts soft and remind us over and over that this person is a person. They were made in the image of God, and that despite how challenging caring for them might be right now, I still am bringing them before the Lord and bring myself before the Lord, praying for myself that I might continue caring for them. Because medicine is hard. And there are relationships that are trying. And just as we would pray for those who are having difficult relationships within our personal lives, I think that there can be great value in doing that with patients that might be more challenging as well.
I wanted to follow up a little bit on the idea of the challenges that you experience as being Christians in this environment. Have you found any specific resources that have kind of helped you to navigate that, whether they be specific for physicians or medical students, or just kind of general principles from any field? But I'm just curious what kind of resources you may have come across.
Personally, I've found a lot of resources through CMDA, the Christian Medical Dental Association. They have a few different like position statements on certain things like abortion, and they have one pretty. I think they have some more literature that they've been producing about like transgender medicine and how to navigate those as a Christian, and a lot of it is informed by scripture. You know, they use really sort of biblical basis to say, you know, as Christians, these are how we should be thinking through these things. So that's been a really valuable resource. And also, you know, the community that resource provides. You know, there's my church, of course. In the times that I was in Rochester, it was really amazing to have a solid Christian community that also was working in medicine at Mayo. And so I've sought that out, you know, since leaving as well. Other Christian physicians that have been in my shoes, whether they are colleagues that I work with directly, but CMDA has been a really good source for that. And there's actually a group of residents and fellows that since the pandemic have been meeting weekly just to pray for one another and give updates. And initially we were praying really for our nation and for the pandemic, and it sort of blossomed into this just nationwide resident and fellow group of CMDA trainees. And a lot of that different, like that group and other Bible study groups that I've been a part of, Christian community, has really been helpful, just praying for me as I've been trying to, you know, navigate certain challenging issues.
I'll add that Duke has a center called the Center for Theology, Medicine, and Culture. And that's been around for probably coming up on a decade now. Dr. Ryan Antiel is someone who certainly is familiar with the program as well. And they not only do they have weekly seminars that are put out in a podcast that are engaging with faith and medicine and the whole care of patients, but they actually do have a fellowship that you can go to either during medical school or during training. It's not working out for me with family and so forth, but it is a resource that they now actually have a hybrid model where you use some online, some in person. But it's a center that really is dedicated to that intersection of faith and medicine. And several folks actually have dual appointments in the medical school and in the divinity school. So that's another place that you could look for those resources. Maybe less specific topical, but more of a place that you can kind of engage and kind of sit in those waters and take up what you can with the time that you have.
Great. Any other resources? You guys mentioned, I think Dorothy Sayers came up, and C.S. Lewis, even more kind of oblique resources. Anything else that you'd say, this is a book that I think as a Christian in the medical field, this would be a key book, resource, journal, whatever?
Wendell Berry. Hannah Coulter was one that I read around my medical clerkships that kind of gave me a good perspective. Gilead, another one. And ones that, and as I kind of alluded to before, as I was thinking of going out to Philly and trying to understand these people I'm caring for, I think those are ones that really show what it looks like to engage in community. And then with Gilead, what it looks like to, at the end of life, be looking back on what matters and what doesn't. I'm currently reading through C.S. Lewis, A Grief Observed, which is a brutal, brutal book. If you haven't read it, like it's really raw and brutal. But I know that this is probably what the parents of my patients are going to be going through. And so studying the humanities in areas of the medicine I'm caring for, I think trying to find a synergy between those, and definitely finding it in fiction as well.
Great. Yeah. Grief Observed is the Lewis's raw journal of as his wife died of cancer. And he actually published it under the pen name N.W. Clark, because he didn't want anyone knowing that the Christian apologist struggled this much with watching his wife die. So initially he thought it needed to be out there, but he didn't want to have his name on it at first. Actually, that's how raw it is. It's a great resource. And then Hannah Coulter by Wendell Berry, great one. And Gilead, and I'm spacing on her name, the author of that,
Marilyn Robinson.
Marilyn Robinson. Really great resources. Any others?
I was going to suggest Tim Keller. He has a book, Every Good Endeavor, I think it's called, that I thought was pretty helpful as well. And I think his church has developed like a center for faith and work that they had different material come out of. There's also, I think, maybe more towards specific issues. I really enjoyed reading Nancy Pearcey's book, Love Thy Body. I found that was a really good sort of cultural critique, looking from like a theological perspective about and addressing that, applying that to a lot of the current ethical issues like abortion and transgender medicine, LGBT issues, a lot of ties that she was able to sort of set a framework for. And that was a great resource for me.
Another one I'll add, Stanley Hauerwas's, it's called Suffering Presence. He's a theologian at Duke. And he wrote it, it's a reflection, it's like theological reflections on the disabled. And so it's a combination of what does medicine mean, what's the purpose of medicine, but also how do we as a medical field, how should we care for those who are disabled, and how should we care for their families, and kind of how does the medical field interface with them. Really interesting, pretty theologically dense for parts of it, and incredibly practical for other parts, especially going into pediatrics, where I'll be seeing a lot of that.
Dan, I mentioned Martin Luther earlier, and his writing on vocation. Related to that, Gene Edward Veith has written on vocation, and I have found that very meaningful. And in terms of specific issues, one podcast or another, I mean, I listen to podcasts with regularity on some of these issues, and I found them very helpful. And we talked about burnout's been mentioned before, and I'll just throw out my resources for burnout. When I go in the room and shut the door and it's just me and the patient, that's therapy for me. And so that's one thing. And then the other thing, reading physicians' memoirs, especially physicians' memoirs. There's not that many out there, but there's some, and as I read these things, it's charging for me. And this is why I'm doing this, as they tell stories about their careers, their practice, and it's always personal interaction. I mean, there's the occasional, very interesting medical mystery or something like this, but it's usually the personal interactions. And that's what I find so meaningful, as I've said, about knowing my patients through many chapters of their lives, through losing husbands, losing children, losing dogs, retiring, dwindling. Patients every week tell me it ain't fun to get old, and to go through those challenges with them. Anyway, rambling. I'll stop.
This is so helpful and good. I know that we're running out of time here, and I did want to ask if there's any question that any of you wish we would have asked, or any kind of thoughts that this discussion has brought up that are new questions for you. But before I set that down, I just want to throw in here somewhere that a quote that is kind of the heartbeat of Alcuin Study Center, and this is beautiful of hearing how this is playing out in this conversation. It's a quote that's attributed to Hans Ruckmacher, an artist and art historian who is friends with Francis Schaeffer. I don't know if he actually said it. I've looked everywhere to find it, but it still is a great quote. It's that Jesus didn't come to make us Christians. He came to make us fully human. That at the fall, the humans that we were created to be were damaged. And you guys experience in your work that damage in all sorts of ways every day. And the idea of Christ redeeming and renewing his creation is to bring it back to what he had created it to be in the first place, fully human beings. And I just wanted to kind of toss that out there, that the gospel, I think, often is kind of abbreviated a bit too much. And what I hear you guys speaking to is a very holistic, whole person gospel that says Jesus isn't so concerned about are you in this little group of people. He's concerned about you being fully human, right? Being who he designed you to be in the first place. So any questions, any thoughts that any of the rest of you would like to throw out there? We'll just gotta go around there. Maybe Keith, go ahead and see if we'll go around the horn here.
Yeah, a really big part of my life has been missions work. I've been on somewhere around 35 missions trips, many to Mexico, Bolivia several times, Haiti 5 times. Went to Haiti just months after the earthquake, and then served there for a week for 5 years. And I would really encourage the students to take that opportunity to go on medical missions trips. CMDA does a fantastic job with their ministries overseas. It's a tremendous experience. They get to do some medical things that they wouldn't be able to do in medical school. And it just gives them a different view on just how privileged we are to live in the United States, and gives us a lot of empathy for how the rest of the world lives. And that to me has been life-changing, to just fully appreciate what God has blessed me with, and humbles me that the vast majority of the rest of the world doesn't have anywhere near what the abilities that we have in this country. It just puts life into perspective.
Yeah, that's really good. Thanks. I know that Matt has to head out real soon here. So Matt, any final comments before you need to go?
Sure. So quick thoughts. So I think as we look at our healthcare system in America, as we look at medical education, I think that people are realizing that there's something missing now, and it's happened gradually or it's happened in fits and starts. It's definitely happened though. And I think that the things we're discussing about whole person care and about what it means to be a physician that understands people and that really loves people and is willing to pour themselves out. Because medicine is, look at the hours, you look at residency, you look at, all these things, it's pouring ourselves out. And I think that as Christians, we have a really unique opportunity to model in Christ of what it looks like to pour ourselves out. But unlike Christ, who poured himself out and did it to the entirety, and at the cross, said, Father, why have you forsaken me? We actually have both the Spirit of God and the people of God to pour back into us. And so I think we have an ability to pour ourselves out and to care for our patients and to change the healthcare system and have vision of it, that I think is really unique and something that we really have to offer. And so I think whether you're in medical training or whether you're caring for patients, I think the more we engage with our Christian faith, the more we engage that with our patients, with our colleagues, I think that's a witness, and that's going to have an impact on this world and on our patients in a really tremendous way. So I would encourage people to continue doing that. And thank you for my time. Thanks for having me. And I think Dan will give you my contact info, so I'd be happy to chat with anybody offline.
Thanks, Matt. That was beautiful. Kayla or Andy, either one, final comment.
Yeah, I do love that the conversation we've had has sort of centered around this whole person care. And I think the quote that you read from Hans Rickenbacker, or whomever that's attributed to Hans Rickenbacker, is beautiful, because I think that's always how I've seen my role as a Christian first, and then physician, and then all the other subsequent identities, is really to like do unto the Lord, as I'm doing to my brothers and sisters. And I think really, like, for me, there have been times medicine is hard, like Matt said, it's pouring out. I'm kind of coming to the end of my training, and I'm going to be starting finally as my own attending surgeon this summer. And so that's been a really stressful period, where a lot of times I've had to kind of recenter on the calling aspect, really rely on the fact that I feel like God's brought me into this field, and is by his grace doing work through me, and then being open to what that might look like. I do think there are different seasons of that. Like, training is one pretty challenging time, and now I'm sort of in a season where I'm like kind of reminding myself like what it is that brought me into medicine, what kind of doctor I want to be, what kind of culture I want to establish in the workplace that I'm going to after this, and really centering on that. And so this has been a really great reminder of that. And I think really grasping to those core Christian values are what ultimately will make us excellent physicians.
Fantastic. Thanks, Kayla. And Andy, what do you got?
Well, Dan, I for the next conversation, a question to consider would be how we as Christians navigate the uh, the, uh, the the environment of government medicine that is coming, and it was here, and it's increasingly coming, and also the concept of population medicine. Um, a little more of my background. My father was a rural physician in West Tennessee. I remember very well going on numerous house calls with him. Saw what medicine was like in those days. And then, I became a physician in 1983. That was right as computers were coming in and of course, increasingly. But now most American physicians, anyway, and this is probably true worldwide, work in one way or another for the government. And the latest thing in America, at least that I'm hearing about, is population medicine. And just put my cards on the table. I didn't go to medical school. I didn't learn how to take care of populations, and I reject the concept of population medicine. I went to medical school to take care of individual patients. And so, next conversation, consider talking about interaction with government, the forces that are brought to bear on physicians as a result of that, and also, individual versus population medicine.
Great. I look forward to the next conversation and talking about those exact things. Andy, thank you. Bart, any last questions, thoughts?
I just want to thank you all for taking time out to do this today. I think it's going to be very helpful for everyone that watches it, and I've learned a lot myself. So I definitely appreciate all your time and your insights. So thank you.
I echo that. Thank you very much, everybody.